We had some technical difficulties last time we gave a talk here, so I'm going to give a little bit of a shorter, brief explanation on what we actually talked about rather than going through the whole thing again. So bear with me. So last time we had part 2 of our Digestology series, where we talked about the small intestine, the colon, and the microbiome, or the bugs in your gut. Okay, so basically with the small intestine, it's made up of 3 parts, duodenum, jejunum, and ileum, and its basic main role is absorption. So it's absorbing the nutrients that we need to survive throughout the day. It has little things called villi that catch food. It also has a slimy layer, a mucosal layer that helps to protect it. And that's one of the things that you definitely want to keep healthy as you go along through there. Remember too, part of the small intestine, you still get some digestion down through the first part there where you get the pancreas and the gallbladder breaking down further fats, carbs, and proteins so that you can absorb them later on as well. One of the other things that incorporates in here too is what we call the MMC. This is what sweeps things along. So that's the rumble in your tummy that you get when you're hungry. So this is very important. So if you don't have that, things tend to slow down digestion-wise. And what we know in the small intestine is that you need to be able to digest and absorb in a very quick fashion, otherwise it doesn't occur. So those people with constipation often have digestive issues, obviously. In the colon, main job is to absorb water. This is why constipation is the big issue. So when we are dehydrated and it's pulling all that water out of the stool, then it gets harder and harder to pass. Other things here, this is where you're feeding a lot of your bacteria. This is where most of your microbiome lives in. Also, there's a transit time here that we want to be mindful of 18 to 24 hours for that food to really go from the beginning to the end. So anywhere past this, we start thinking of constipation issues. And yes, you should go to the bathroom every day. The microbiome, there's 300 to 1,000 different species. So we've talked about this many times about how diversity really is the key to your overall health inside your digestive system here. Also, another cool fact is there's actually 200 times more genes in your microbiome than there actually is in the human body itself. So something very cool. What these bugs do is they help digest our food, regulate our immune system, protect against other bacteria. So when we start talking about some of the things like dysbiosis, when we get overgrowth or undergrowth of good bacteria and bad bacteria, we have issues there. They help produce our neurotransmitters, so there's our link for our anxiety and our depression issues. And they help, everyone knows that, a lot of people know that now, that 70% of our immune system, up to 70%, is housed in our gut. So there's our regulating our immune system. So let's talk about a couple other things. So one of the big things that we have going on in our gut, when we get an imbalance really is what it is. It's what we call dysbiosis. So this dysbiosis occurs when we have either too much bad bacteria and too little good bacteria. It could be, we can even have an imbalance of some bacteria that are beneficial for us that overgrow as well too. Or we have just enough good bacteria, but there's an overgrowth like an infection that starts to overtake the intestinal tract, and there's where we get some issues there. So really it's not a healthy, stable state that we would normally want to be in. What it leads to is a leaky gut. Now this term leaky gut isn't recognized by medicine just in general, but they are finding in studies that this truly is the case, where we actually get a separation of the cells in the gut, allowing things to pass through that shouldn't pass through, whether it's a bacteria, virus, a yeast, fungus, things like that. Even large particles of food will get through there that isn't completely digested as well too. So that becomes the issue. Why does this happen? Number one, the membrane or the mucosal layer starts to wear down. So that's our protective coating of the inside of our stomach, or inside of our stomach and our small intestine. But when we're born, we should be getting breastfed, and our first thing is that we're given is colostrum, and that's really our first protection from the outside world. Because when you think about the system of the digestive system, it is an open-ended system, right? You have your mouth, and then you have the other end where the stool comes out. So you can test for this area. We do a test called the secretory IgA test to see if this is actually, if you're starting to see that in your urine or stool, that we know this is breaking down. It shouldn't be outside of your digestive tract in large amounts. The other main thing is inflammation. So inflammation can lead to the breakdown of this layer, but what are some major things that cause the inflammation? Our diets. So the standard American diet, where 75% of it is of very little nutritional value. We have obesity, joint disease, and depression, high sugar, low fat, and low fiber. The pesticides, especially glyphosate, this decreases the layer, especially, so it actually eats away at that layer. We've seen an increase of Roundup by 6,500% since 1991. And people used to believe that you could wash it off, but you can't wash it off now because it's within the food system now. And it's contaminating all over the place. It also, what glyphosate also does is it really stops the liver from doing its job. So then we start getting issues with detoxification as well. It attacks the microbiome, so it actually decreases the beneficial bacteria and allows us to have overgrowths of things like salmonella and clostridium, which are two toxin-producing fungi. They show an increase in brain trauma as well, so concussions because of the glyphosate. Some other things that can create this inflammation: heavy metals, food allergies, gluten is a big one. You don't have to have celiac disease, but that definitely plays a role in it as well too. And then plastics is another big one. We talked about the infections and antibiotic use previously in other modules and seminars. But when you take about antibiotic, it kills about 99% of the good bacteria because it doesn't know good from bad. It's just going to wipe out the whole thing. And then if we go back to our regular diet that caused us to be sick in the first place, it's just going to continue to grow those bad bacteria. Parasites is another underlying factor. Medication, especially ibuprofens, acetaminophen like Tylenol, naproxen, so you got your leaves. That definitely creates an issue in the gut and causes leaky gut, even though it's an anti-inflammatory. It creates actually more systemic inflammation. Hormone imbalances, Our next seminar will be on thyroid, so with the thyroid dysfunction, that can slow down digestion, leading to constipation and a lot of overgrowth of bad bacteria. And then estrogen toxicity, especially, will increase belly fat and cause more inflammation in the body. So you see the surrounding, especially when the liver gets bad as well too, and you have a low production of bile from the gallbladder. All right, one of the things, so we talked about secretory IgA, but one of the things that we can test for to see if we have this leaky gut, LPS and zonulin. So LPS and zonulin are two markers that we can test in a stool sample. This is produced by the bacteria that's overgrowing. It's a toxin, so it can create almost a sepsis, a chronic inflammation or a systemic inflammation because of the body's going to start to fight it, so your immune system gets overactivated. And zonulin, when you start seeing this, then that's what holds the cells together of your small intestine and large intestine. When you start seeing this, you know that it's being released, so it's not held together tightly. There's a test called from a lab that we can run called Cyrix Labs. It's called their Array 2, and we can test both of these during that time to see and to monitor, do you have a leaky gut? And what we're doing is beneficial for you right now in stopping that leaky gut. So the prevailing theme now is that all disease starts in the gut. So what does that mean? So because it's an open-ended system and it's really only one cell layer thick, once it gets past that slimy layer and into the bloodstream, that's when the disease states start. So one of the big ones, obviously, is autoimmune diseases, infections that become systemic, and then food allergies is another big one. Because as you eat food and it doesn't get broken down, when you absorb a protein, the body's going to attack that protein and then create antibodies to it. And that antibodies, so as you get repeated exposure, it's going to continue to fight that food when it's not broken down. So one of the big things that people get is SIBO. So it's small intestinal bacterial overgrowth. What this is when bacteria from the colon, or the large intestine, crawls its way up into the small intestine, and in the large intestine they would ferment food. So there's the gases that they're producing. If they're producing that in the small intestine, that's where you get that bloatedness, pain. You can get nausea, diarrhea, or constipation. A lot of IBS people have SIBO. Studies show that 100% of people with fibromyalgia actually have SIBO as well. Chronic fatigue and skin disorders are two very big ones. So the two main gases that you test for is methane and hydrogen. So hydrogen is more tied in with diarrhea. Methane is more tied in with constipation. You obviously will see slower transit times. But what you can do is what's called a 3-hour breath test to see which gas, because it really determines what type of protocol we're really going to use to help kill those specific bugs as well. Some of the common causes, one of the big ones, antibiotic use. That's long been known. It can take up to 4 years for dysbiosis to really start to go away because of antibiotic use. Candida overgrowth. When we have SIBO, Candida is often another player in there. Acid blockers, because when you don't have enough stomach acid, you're not breaking down your food. It creates this issue. H. pylori especially can occur too with the acid blockers, but H. pylori itself will cause reductions in stomach acid, which we talked about the last seminar. Previous constipation issues, gallbladder, liver issues, poor digestive enzymes from the pancreas. The last 40, 50 years we've been on a low-fat diet, which has basically meant we've eaten more sugar and carbs, so that definitely creates, because that's what they want to feed on. Parasites, and then stress hormones, especially cortisol, the big one, will increase bacterial infections because it's decreasing your immune system. So how would we treat SIBO? Depending on which one we have, we use digestive enzymes, because there's some replacement there, right? Sometimes we have to replace hydrochloric acid as well too. We usually are going to want to hit some bile salts, because people's gallbladders are not functioning, especially in Minnesota. There's a high percentage of people that actually don't have theirs. We need to kill the bugs, right? That are causing the SIBO. So we can use some botanicals, some essential oils, some what's called caprylic acid. So this is what's in coconut. It's just refined down. We can use some garlic. So these are some of the major things. One other one would be a berberine to help kill some things. So this is, depending on which one we use, it's kind of a combination of these things that we would use. Once you get the bugs killed, then we usually we're going to want to add in vitamins A, D, E, and K, because they're getting depleted because they're not getting absorbed in the small intestine there, where the SIBO usually is going to attack. We'd increase, a lot of times if we have that constipation issue, we're going to want to increase some motility, so we'll use mag citrate or some things to help calm the anxiety and depression down, to help people go to the bathroom a little bit easier. Sometimes we have to go to what's called rifaximin. That's the antibiotic. So usually you're going to want to take about 2 weeks worth of this to help kill this. Sometimes it takes even more. It's very expensive. A lot of times the insurance companies, because they're not on board with what SIBO actually is, you have to pay for this out of pocket. So this actually, and it's not very cheap, that's for sure. Once we go through these, kill the bug, do some replacement there, we're definitely going to want to use probiotics is another. Obviously we want to make an environment where there's better bugs in there, so we get that dysbiosis out of there. And we want to reduce that inflammation that the SIBO has been causing. So turmeric, fish oil, there's what's at the end product of a fish oil called SPMs. Those are modulators of inflammation we've talked about before, but very effective in digestive disorders. We want to increase fiber slowly. So remember, there's soluble fiber, which helps feed the good bacteria. So as you're giving probiotics, we want to be eating some soluble fiber. And insoluble fiber, where we're brooming up things and trying to sweep things down. On average, the American society gets 3 to 5 grams of fiber a day, and we should be at 20 to 35. So we're falling way short. One of the other major issues that people have is irritable bowel syndrome. So it's not a disease, but there's 2 types. There's IBS-C and IBS-D, and sometimes you have the alternating one, which is less common, where you toggle between constipation, diarrhea, so you're just alternating between that. What we would normally use, especially for the constipation one, when I see this, I'm already thinking gallbladder. Do they have one? If they don't, then we definitely want to use bile salts. We're definitely going to be using bile salts because bile salts helps break down your food. And so that allows it to pass down easier. It also is antibacterial, so it can kill a bunch of things. We want to increase water. A lot of these people are dehydrated. And we obviously want to slowly start using some fiber. Slowly, because if you constipate them even more, they're not very happy about that. With the diarrhea, this is usually due to infection. Often people hear of traveler's diarrhea and they use their probiotics, so that's where we definitely want to kill that infection. This also is a stress issue, and remove any allergens that are causing that diarrhea. Between this, it's usually a combination of these two when we're toggling back and forth, where we improve gallbladder function, might do some digestive enzymes, things like that. With these ones, with the cramping that a lot of people get, we use a product called Inasol that helps with that cramping. That's very, very effective. The hard part, this is usually just diagnosed because all the labs are normal, and the tissue biopsy or the colonoscopy is normal. So they just get this label of IBS for those people. All right. So when there is something seen on labs, inflammation, or on a colonoscopy or a CT scan, we start thinking of ulcerative colitis. Often people just call it colitis or irritable bowel disease. This is where that imbalance of that gut flora really is gone to that next level, where there's so much inflammation, so much toxin, it's actually doing damage to the gut lining and the gut cells there, and you can see it now. There's bleeding in the stool. Some of the symptoms that people have are fatigue, eye inflammation, intestinal scarring, joint pain, bleeding, weight loss, bowel urgency. And there's often, with this one, there's an autoimmune complaint. So there's where you have to really start healing up that gut with a few things, and we'll talk about that. The other one would be Crohn's disease. So this is different from ulcerative colitis, is that this one has more patches rather than the whole system is being inflamed. So there's patches of inflammation here. The inflammation is at varying depth, and this is primarily lower GI issues. And people have diverticulitis. Actually, it's diverticulosis that leads to the itis. So this is when the large intestine has little pouches there, and there's infection within there, and then that infection causes inflammation and pain. So with these people, you have to put them on a low fiber and restrict food as that gut starts to heal. They can get what's called a megacolon as well too, because they could be constipated and inflamed so bad. So we got to weed the garden. That's getting rid of the infections. We've talked about some of those botanicals and essential oils. We want to reduce the inflammation. Omega-3 fish oil, very, very effective. Vitamin D. A lot of these people are vitamin D deficient. We use those SPMs as well. And I really like a product called Inflammix 360 because that has a bunch of nutrients in there that are beneficial for them that they're not getting in their diets a lot of times. Plus it's got a high dose of turmeric in there, curcumin, that helps with that inflammation. That's very effective. And it's easy to drink. I know that they're getting a good meal at least once a day. We want to replace some digestive enzymes again, possibly some hydrochloric acid, some bile salts again because of that gallbladder. We want to plant seeds, so give probiotics, and we want to feed those bugs a couple different ways. The soluble fiber slowly, but we use a product called Endofin that helps feed those bugs without giving the constipation as well too. All of these need to have a gut healing of the lining. So we use glutamine as a big one for that, L-glutamine. Sometimes I'll use colostrum if they have a lot of food allergies as well too. And we definitely want to use zinc as well. So those are some of the things that we definitely want to look at for that to help with those specific conditions. And everybody's a little bit different. So not one thing is always going to be, not one protocol, not one thing is going to be. So each person is different, so we got to definitely do some other things. Some people will have issues with sleep. Some people have too much stress, so we got to deal with that. Some people just need a little more exercise, so getting them up walking, moving around. And a lot of people are just really, really short on their overall nutrients, so we're nutrient depleted for most of the population. So we often recommend called the Foundational 5. So when we start healing up the gut and we want to add in just overall nutrients, we want to use what we call Phyto Multi, which is a multivitamin with polyphenols in there. So it's like eating plants, vegetables. So that helps with that, to decrease inflammation, better absorption there. We use vitamin D, of course, as a 5. We want to use fish oil. We want to use a probiotic that is strain specific, so probiotics are super important. In another video we'll talk about what to look for in a probiotic and why. We want to use magnesium. So these are the foundational 5 that a lot of people are deficient in for various reasons, just not getting in their diet. So that we definitely want to have patients do that. So those are the big things that we went over during our last summer in Digestology. Our next seminar, because it piggybacks with this, because a lot of people with gut disorders, they have hormone imbalance. So we're going to talk about thyroid, specifically hypothyroidism for most people. Estimated that up to 40% of people have hypothyroidism. So it's definitely an issue that people have that come into the office. And a lot of them, 15 to 20% of that 40% is undiagnosed until it gets all the way down. It can take up to 15 years to really diagnose Hashimoto's disease because the lab testing is not very sensitive, and they're not looking at it in what we call functional or optimal range. They're looking at it in the broad range for people. So by the time they get outside the range, now you have a disease, now you're going to be placed on a medication. So we definitely want to see that we're not heading towards disease, but actually towards health. And because with the constipation issue, that leads to those SIBO issues, and then you get this cycle of SIBO causing estrogen issues, which can cause more thyroid disorders. So it becomes a vicious cycle for a lot of people. So we'll discuss some of the most common reasons for that low thyroid function, and I think you'll be surprised on some of the things that we talk about, because people just think of it as the thyroid itself, but there's other things that are involved with the thyroid. So we'll talk about some of the most common patterns that we'll see in our office to help people with, and what they can do about it and what you can do about it. So I hope you enjoyed this video. Please like us on YouTube and share it with your friends.